Welcome to a special presentation dealing with a northern bubble. And we have a distinguished panel with us for this session. And I'd like to just introduce them as we go here. First of all, Jim Gordon, former Sudbury Mayor, of course, and a former member of our provincial parliament for many years. Dr. Peter Zalan, retired doctor at Health Sciences North and represented the medical staff for several years as well, and appears regularly on the media. Dr. Klein, who's co-chair of the Ontario Health Coalition, broad mandate for health concerns, including seniors, and Hugh Kruzel, who's chair of Northern Ontario chapter of CARP, the Canadian Association of Retired Persons, representing older adults, 50 plus. It's a national organization. And I'm John Lindsay, a president of Senior Friendly Sudbury, another advocacy group for seniors. Just before we get underway, just a brief comment from the press releases that have been sent out so far. Dr. Zalan said, from a local perspective, create the northern bubble. This is a call for the province and for Northeast mayors and councils to support Brian Bigger's initiative. Brian Bigger, of course, being the mayor of Greater Sudbury. And Jim Gordon, in his release, in one line, stated, Northerners and Sudburyans have kept COVID numbers down by following the rules. Travel is the primary way the virus moves. We need the means to stop social travel in and out of the north. Give us the tools. And as far as Hugh Kruzel and myself are concerned, we've advocated for seniors for years. We're the group most at risk. And I think that most seniors in our area have kept themselves within their own bubbles and been very responsible because, as I said, we're the ones that could be most effective. And of course, Dr. Klein has been very outspoken in the media with respect to treatment of seniors in the pandemic. First, let's hear from Jim, who basically is responsible for this session today. Jim?
Well, thank you very much, John. Well, you know, we're the Sudburyans are like the family that went camping, their first camping trip in the summertime. And they're in their tent, they're doing everything right. They've got everything they need. They've got their mosquito nets and everything. They're holding them up, admiring them, and suddenly find that they're enveloped with mosquitoes. And they find they're being enveloped because a screen in the back of the tent over the winter in travel has come apart. That's what we have here. Here we are with our mosquito netting, covering our families and everything, protecting us. And what we don't realize is in our house that somebody didn't fix the back door screen. We have to do something about entering and leaving this community. And there's a very good reason why. It's COVID time, but it is the UK variant time. And now we even hear the South African time in Canada. It's on the loose, creating havoc in Southern Ontario. We don't need that virus here. And you know, it's pretty well too late once it floods into your community. So we don't have much time. So we're really calling on the Premier, who discovered by closing off international travel that you can find COVID by doing that. It was the right thing to do. We admire his efforts. He's doing the best he can, but now he has to give Northerners the tool that we need. We need to be able to control what's going on. And so that's why I'd like to turn to Dr. Peter Zalan, who has spent hours, literally hours and hours, writing, visiting people, trying to get them to understand and see what we're up against and what we should be doing. So Peter, could we ask you to comment and talk for a little while?
Sure. Thanks, Jim, and thanks for everybody who helped organize this. I like your camping metaphor because I like camping, although I never did like winter camping, which is the current state of affairs. Anyway, good morning and thank you for participating. So we organized this press conference to follow up on Mayor Bigger's words from yesterday. We used to be mellow here, actually living in Sudbury, far removed from the viral chaos of Southern Ontario, low infection numbers, few hospitalizations, no deaths since the spring. So we figured, well, we had it pretty good and we could just carry on with doing whatever we're doing. Anyway, we can no longer assume that the coronavirus is not a danger within our community. I'm worried. I think others are worried. Brian Bigger is worried. It's all about the variant and what's going on in Barrie, which is pretty close to us. It's a big, big outbreak that progressed extremely rapidly. The number of active cases actually is over 1,000, if you imagine that number, for a population about the same as ours. So ours is in the 80s. It's clear that the variant arrived via travel from the United Kingdom. It came to Sudbury via an international traveler, and it's now in Kingston after a visit to Barrie. Planes and cars. So it's everyone's hope that the vaccine will fix the COVID problem. That won't be anytime soon. And let me talk about a little bit about Israel. If Israel is any example, things will get worse before they get better. Israel is a test case for vaccination, actually. They're by far the leaders. They're quite amazing. 1 in 3 Israelis have already received at least 1 shot, and 1 in 6 have received 2 doses of the Pfizer vaccine. The good news is, and we can celebrate this, is that 2 doses work great. 1 dose works so-so. The bad news is that the infection statistics in Israel are actually now worse, even with a new lockdown. How come? So, kind of surprising. The presence of the new variants of the virus identified more than 50% have been identified in more than 50% of new cases. It really spreads quickly. A weakening of the public's cooperation with public health guidelines, the so-called pandemic fatigue. So let's now talk about Ontario. Well, the variant is in Ontario, and our citizens certainly suffer from pandemic fatigue. All that sacrifice during the first wave, all we got in return is the second wave. So how many more waves in the future before the vaccine kicks in? So here in Ontario, on the 29th of January, the province announced mandatory on-arrival testing of international travelers. This is actually 4 months after the variant was diagnosed, and enhanced screening to identify the new variants. And how about our roads? There's been no announcement on enforced intercity or inter-province travel restrictions. We've had lots of words, but no enforcement. Nor has there been any announcement of testing of essential travelers on our highways. For example, truck drivers who bring essential supplies to our communities. I mean, some from the States, some from Mexico, and some from here within Canada. The provincial data has shown that mobility and contacts between people have not decreased with all the urging that has gone on. People are fed up. From the local perspective, as Jim said, create the northern bubble. Also test essential travelers and vaccinate our high-risk citizens. We're certainly talking about people in long-term care homes, but there's retirement homes, and include all those folks who are high risk living at home as soon as possible. This is a call for the province and for the Northeast mayors and councils to support Brian Bigger. I think we deserve protection. Anyway, I'd be happy to answer questions.
I think we could go to the media now and ask if they have any specific questions with respect to former Mayor Gordon and also to Dr. Zalan.
Hi, it's Helena.
Hi, Helena.
Hi. Have you reached out to other northern mayors, or have any of them expressed support for this?
Well, we would hope that Brian, of course, as a matter of fact, I do know that he has had some conversations in the past with some of the other northern mayors. I think the situation now with the UK variant being part of this very volatile mix is going to mean that it will be a lot easier, I think, for Mayor Bigger to encourage the other northern mayors, and I think their councils and their people will be quite willing to find a way to have more safety.
Okay, thank you.
Do we have any other questions there from the Sudbury
Yeah.
Star?
Hi, this is Colleen Romaniak from the Sudbury Star. Can you hear me all right?
Yeah, hi, Colleen.
Hi. So my question is, what would this northern bubble look like? How would this be accomplished?
Well, I think, Peter, do you want to address that or first?
Well, as Brian Bigger said, he didn't want to get into specifics, but presumably it would have to be checkpoints on our highways.
There would be signs up. I mean, they have the provincial signs, and those signs could say very clearly that if travel for business, but not socially. And if you're stopping people and you're going to get somewhere. And I think the other thing is we do have now, we know the kind of testing, rapid testing that they could have people who are coming through on business could take a test and have a pretty good indication as to whether or not they should be traveling further as well. So there's ways to control things. But you know, it's a long road. There's not many roads into Sudbury, in actual fact. It's not difficult. It's not difficult. Look, we have people who work, for example, in fire departments all along that route. I think they are very well-trained individuals, and they could be brought on and deputized by the province to handle things like this. But I don't want to get into those kinds of logistics. We are speaking on behalf of our community, a community that has really done everything they can to avoid coming down with COVID or spreading it. And they've suffered. There are many people suffering mental problems as a result of this. There are many people who are scared silly, and as they should be. And there are children that are suffering as well. I mean, they can't go to school with their kids, or, you know, they're not playing normally anymore. They can't go for sleepovers. I mean, just think of it. We all know we're all part of this. It's time. We've done our bit. Now it's time for the government to step up. The problem is our governments, all governments are like this. So you can't say, well, it's the Premier's fault. But governments are slow to react. They take way too long. They wait till the horse is out of the barn. And then they do things. Well, it's not going to work. And it will cost more to the economy of this province if they don't step up now and clamp down. We need this bubble. There's no fooling about this. We want it. We've put up with it. Now it's time for them to show real leadership. And when I talk about leadership, it's you've got a backbone, you do what's necessary, and you get on with it.
Do you have a follow-up question from the Star or Helena?
Yeah, I do have just one follow-up question to that. There have been, there's been some talk about what it would mean to establish laws like this. And there are some, constitutional law experts and stuff out there who have said that there might be some issues with establishing travel restrictions and stuff like that. So what would you say to critics of something like this when they say maybe that their freedoms are being restricted or, any other questions like that?
Well, this is what I call the boo baby syndrome. Boo babies do this all the time, but we're in a war. And when a war comes along, governments do what they have to do, and they have no trouble passing regulations and laws to make sure they get where they want to go. This is a war, and this virus travels on people. It mainly on people. It doesn't fly in. It's not hard to do. The maritime provinces did it. They just have to pick up the phone and say, oh, what did you do? Or call New Zealand, talk to Australia, talk to the Philippines, talk to the Koreans. I could go on and on. Around the world, countries have taken necessary steps. And, you know, you'll find that they'll say, oh, well, you know, those countries are authoritarian. Well, I've been to Australia. Those people know how to live, let me tell you. And you wouldn't find a more joyous people. They accepted all kinds of restrictions. New Zealand is a good example. She went for an election afterwards. She had a landslide because she did the right thing. What's wrong with Canada? We seem to keep going along, you know, oh, well, we can't do that right now, you know. Then a month later, they do it. Come on. Enough is enough. We've done our bit as citizens. Now it's up to you as government, as elected people, to step up.
There's a classic ad on TV right now. It's been around for a while from the federal government. It shows a lady arriving at a site, putting a mask on and saying, I'm doing this today so we can do these things tomorrow. And it shows people talking and gathering. I mean, there are times where we're going to have to do things now because the implications are horrible if we don't do something now. I posted on the chat an interview I did with Dr. Peter Zalan on the 3rd of April, 2020, where he first suggested the Northern Bubble. April the 3rd, 2020. That is, I don't know how many days ago, I should just calculate it, but our reaction time is terrible. Peter, thank you.
That's correct, Hugh, and Hugh and I interviewed Dr. Zalan as part of one of our Zoom calls for the CARP, Canadian Association of Retired Persons, and that was sent out many, many months ago. And Peter, you've been saying basically the same thing since that time, but just one question.
Dot, I think Dot wants to say something.
I was going to say Highway 69 is really a two-way street. We've talked about keeping people out. How about our own people going down south? So what's your position there?
Yeah, exactly. It's a two-way street. We had a big outbreak. I remember back after Thanksgiving, we all had misgivings with Christmas because we knew what would happen. And lo and behold, the lockdown started after Christmas. And our active infection numbers went up to 99 in Sudbury, and we've had deaths in Amberwood. So we know that people misbehave, and they're fed up, and we need enforcement.
Well, you know, most of us on this call are classified really as seniors, including Dorthy Klein. She's a little less a senior than perhaps Jim Gordon and myself, and maybe Peter. But Dot, you were talking about when people come north, maybe businesses along the way have a responsibility as well to sort of control traffic. Is that correct?
I want to speak, John. As you can see, I'm the only woman on this panel, and I really and truly feel that we have not really strengthened the systems that we do have. And we have encouraged the population, all the population, for hand washing, wearing a mask, and they've done extremely well, and they have not really been appreciated. And that's why they're fed up, because they've done it. And yet the variant is just below us, actually, about 200 kilometers, and it's coming. And, but we haven't strengthened, we haven't really pushed at the government to strengthen the restrictions at the border at the Sioux. I did read very recently that the mayor at in the Sioux had asked or had searched around to see if he could shut off the roads, and he was told very bluntly he does not have the authority. nor does anyone. It's a Trans-Canada, and that's what we've got it coming in here. He also indicated that he had approached First Nations because they own the land going into the Sioux. And again, that would take some negotiating. But we do know that we can encourage private businesses only to serve locals. And I have seen that happening around the province, certainly in the north. So I think we've got to really be much more open with our education. Instead of telling people what they have to do, really encouraging them to come and participate in this fight against the coronavirus. And I agree with Peter. We did really talk about shutting off the highways back in April, and we found that we couldn't. And so when you can't do something, you can find another way to do it. But we've really got to push with the government that's provincial and federal, because people are coming across the border very, and the transports. I don't know if any of you have noticed the transports coming through here on the way to the Sioux with livestock on them. There's no slaughterhouses between here and the Sioux. So you know they're crossing the border. So I really believe that we've got to, and we can do that. We've got people who can talk more to the government officials. That's what we did with the Ontario Health Coalition. We really strengthened what was going on at the border at Niagara and Sarnia and Windsor. Now, and just like Jim mentioned, once a horse is out of the barn, it's really hard to catch him and put him back in. In fact, it's almost impossible. But we had to do something there. So now a lot of the transports are coming up this way, crossing at the Sioux. Some of them might be coming, going up to Thunder Bay, but the Sioux didn't have the outbreak that they've got now, nor did Thunder Bay, nor did Sudbury in the first wave.
Well, there we are, and we only have about 5 minutes left. Alana, do you have any other questions, perhaps for Dorothy or for Jim? I know that Jim has served, of course, for many years in our provincial legislature, and looking at, we do have the highway going from east to west here through Sudbury, and that does present some concerns. Jim, is there anything that the provincial government can do in that regard?
Well, I looked at Alana. Did you have another question you wanted to ask?
Well, I don't want to burn up your time. I'm going to contact you after this to try and arrange an on-camera interview.
Okay. Well, yes, I'd just like to say this. It's time for our governments to really step up. They're losing the people, and they're losing us because they're not, they're, sort of waffling back and forth. Now is the time. We have this variant. It's virulent. It's unforgiving. It doesn't care who you are or what you do, and it will eventually get into your house. Mm-hmm. It's time you protected our houses. The time has come. We know that the Premier is doing everything he can. He really is. But he has to maybe get some advisors that are up to standard. When I talk to people who are at the head of health units, and they tell me that the head of the government, Williamson and those guys, they're not listening to us, they say. Our hands are tied. Who do you think is best qualified to inject a needle into somebody's arm? The health units, they've been doing it forever. The doctors, the family doctors.
Pharmacy.
There's too much waffling. It's time for them to step up for the people who are making all the sacrifices. We won't get into some of the elected people who didn't make
Jim, I just wanted to add from the perspective of CARP that we have no consistency in health unit reports. We have no, even our health unit uses WordPress as a platform for sharing information. I sent you a document that had been prepared and released. You had never seen it. The distribution of information, even at the health unit level, is poor. It is not consistent. I can go to Kingston and I can find much better results. Why is there such discrepancy and disparity between northern health units and southern health units? Why is there differences in reporting? Why is, as you just said, why, when we've had time since my interview with Peter Zalan, April 3rd, have the health units not come together and said, we need to pool our information in better ways, we need to share, we need to think forward on how we're going to do this? And why, Klein, is the College of Nurses not saying we reactivate every nurse who wants to be reactivated and be able, I understand there's a restriction where they're saying you have to pay your fees, you have to be requalified, you have to do none of those things. Do those later. Let's get everybody who can vaccinate and wants to be vaccinated. We need to marry those people together along with adequate quantities of vaccine. The UK, 8.9 million doses have been delivered, not just delivered, put in arms. We have things that have been delivered here and have not been shared with the people. And that shocks members of CARP.
I wonder if Helena has any other questions before we go for a final wrap up from Dr. Zalan.
No, I'm good. Thank you.
Well, thank you for joining us. Dr. Zalan, looking at what Jim Gordon said in the beginning, the mosquitoes are coming in and we're all going to be bitten sometime unless we can close that screen door somehow. Your final comments?
Well, I'm really hopeful that we're going to get some activity now. I really liked the press release from Mayor Bigger. I hope he convinces the rest of the North to also participate. And I'm really hoping now with the latest action by the Premier about international travel that he now knows he has to do important things quickly, and that will and continue its bring in more measures now with travel on our roads and testing.
Well, we hope that the message will get out there, our support for Mayor Bigger and our concerns with respect to creating a Northern Ontario bubble. We have only a very small percentage of the Ontario population, but we do have a significantly high number demographically of older citizens, and these are the ones that are mostly at risk. And that's why Hugh Kruzel is CARP and myself friendly to seniors. And of course, Dr. Zalan has been talking about it for ages. And we are the threatened group. We are keeping our bubble, but we like it to expand. And of course, we do support Mayor Bigger's efforts in this regard. So once again, thanks for everyone for taking part and for Jim Gordon for arranging it. And we're happy to have been the moderator for this. And we'll be sending out further notices to the media of our support and whatever efforts can be undertaken to achieve our goals. So once again, thank you very much. Goodbye for now.
Jim and John, just before we go, in the chat box, I put a link to that conversation with Dr. Zalan on the 3rd of April. It's been 305 days since we had that conversation, Peter.
Yeah, much too long, much too long.
Time flies when you're having fun.
Well, goodbye, everyone.
Thank you. Bye-bye.
Goodbye.